about the breast. We all know that this is the nipple, right? This is the areola area. The areola area is that black area around the nipple. And then this is the other parts of the breast. So the breast itself, it consists of three main things. After the muscles, intercostal muscles, the muscles in between the ribs, then the muscle that covers the ribs. All right. After that, the next thing that we have are fat cells, fat. And then we now have what you call the ducts. Those ducts are like pipes. The ducts are like pipes. It's those pipes, that's where the milk, when you have a baby, where the milk passes through. Then we have the lobules. Those lobules or lobes, those are the things that, when you pop the breast like this, you feel it's like something hard. So some people are afraid when they do that, hey, there's something in my breast, but these are normal parts of the breast. That's why if we teach you, you know better. So you know what is what and what is normal and what is not normal. Okay, so those are the parts of the breast. Then also, the breast has what we call lymph nodes, areas that drain the blood, that remove the things the cells that are not necessary. We have it all over our bodies. We have for the throat, we have for the ears. So when you have catarrh, sometimes when you go to the hospital, your doctor checks here like this. Abi, do you know, for some of you, have you ever been where the doctor checks in here? What's the doctor checking? Or say I have sore throat, they check here, they check here. You know what they are checking for? Lymph nodes. So if you have an infection, those lymph nodes, they will feel it. It's the same thing with the breast. The breast has lymph nodes. And where are the lymph nodes? The lymph nodes that drain the breast. They are in your chest wall, here. They are here, under your clavicle here. And they are in the armpits. So those three places are also part of the places you check when you're examining your breast. Your chest wall, underneath here, if you are now, put your hands in your clavicle. You shouldn't feel anything. But if there is something, you feel like small balls if there were something. Or for instance, if any next time you have sore throat or catarrh, just put your hands here. Then you will feel something. Now you won't feel anything if you are okay. So those are some of the things. So here and your armpit and under your clavicle. So having said that, I said that when you are checking your breast, you look. There are three things you do. You look, you touch, then you squeeze. So let's go to the look. What are you looking for? You are looking at the two breasts. Okay. We know that usually one breast is a little bigger than the other. So you know which one. And then you look at it. Is everything still normal? The skin, is it normal? Your nipple, is it normal? If you have inverted nipple, inverted nipple is the one that is out like this. Some people, their nipple is inside like this. So they have a little challenge when they have babies. So if your nipple is inside, normally you know it's inside. But if your nipple is outside and then suddenly it's going inside, there's something wrong. So those are the things we're looking at, okay? Is it the same shape? Is one looking markedly bigger or looking shrunken? Or is the skin changing color? Is there a void there? Is there a sore there? Is there thickening there? Those are the things you look for. Because if you see those things, it's a sign that something is happening inside that is not good. You need to have a check, okay? And that's why sometimes they will tell you, raise your hands up. Because when you raise it up, then you can see if there is a change. Or they say that put your hands like this here. Because if there is something, you will see that there is a change in the breast. Okay, so those are some of the things that you look at. So the second thing is I said look, touch, right? And the last one is squeeze. So now, having looked for all those things, the next thing is to touch. And why are we touching? One of the commonest signs of breast cancer is lump. It's not the only thing. Some people have breast cancer and they don't have any lump that they feel. But when they go for test, it shows. Having said, that's why as you grow older, as we will talk about it later, if you are able to wait, there are tests that you can do, especially once you turn 40, or if there is somebody in your family, your very close family who has had breast cancer, then you have to start doing the check. Go to the hospital to have a certain check called mammogram before the age of 40. Otherwise, from age 40, it is needed that people do it, okay? Because then they can find the one even that your hands, if there's no lump, that the hands will find, okay? Because like I said, the breast, I told you about the different parts of the breast, because some of them hide in the lobes, some of them hide in the ducts, and you may not be able to feel it. That's why. So now there are 3 methods or 3 ways if you are going to check the breast to touch it. But first, the first important thing is you don't use the tip of your fingers. You don't use this tip. You don't. You see the ball, like the ball of your finger. Can you look at it? Like the ball. This ball part. That's what you use. So you don't poke, you don't do like this. You do like this. Flat. It's flat on your breast. Not like this, so if you feel like this, you will be touching the lobes. Yay! So it's not like this, it's like this. So you will see that there are 3 patterns in which you can go. There's the going round pattern, there's the vertical pattern, and there's the wedge pattern. So the circular pattern is, I will teach you that, but I just want you to know the different patterns. It's starting from the outermost part. You can start either from around the nipple and then go all the way out. You can also start from outside. I prefer to start from outside, don't forget anyway. Start from outside, then you go pressing everywhere until you get in, until you get to the areola and you finish. That's one method. Another method is to do the vertical one. And you go like this, go down, go down, go down, and you go to the next layer. So it's like vertical lines. And you see the way I'm pressing it down? That's how you do it. Pressing it down. So ideally, when you press down like this, you shouldn't feel anything. You shouldn't feel any solid structure. If you then feel a solid structure, then you have to go back there and feel it. Then you know that you have to have it checked. Alright? And if you feel anything, it doesn't mean it is cancer. It doesn't mean it is cancer. If you feel anything that shouldn't be there, it doesn't mean it is cancer. What is important is immediately you come to the hospital. You come to Kanamek. Come to the hospital. Doctor, I was examining my breast. I felt something. Or even the nurse can do it for you. I was examining my breast. I felt something. Can you help me to examine my breast again? They will help you examine. And if there is something, they can then say, okay, we need to do other investigation. It's from the other investigations that they will know whether it's cancer or not. So you just finding something in your breast doesn't mean that it's cancer. They say, I found cancer in my breast. No, you can't know that. Even the doctor, even when they see it, welcome to those of you who just joined us, they themselves will not know until they've done tests, but they can have an idea of whether it's likely to be cancer or not. So as I was saying, so you go down, and now for those of us who just came, we've not started the discussion part because some of them have to go back to the office. We're teaching you how to examine your breast first. And so we go down. So you can see I'm going methodologically. I'm not missing out any part. Even the nipple area, I'm pressing it down. So I don't expect to feel anything there. So I'm going and then going and going until I'm done. Remember that I started from here, remember? And then I said, when you check here, you also check your underneath your clavicle and you check your armpits. Yes, you are listening. Thank you. You check your armpits. So you do that for the right breast, you do that for the left breast. So the other third method is going like this. I don't always recommend that people use this method because if you are not used to it, you may miss out parts. So I've gone like this now, and I'm going to go like this. So I've gone cross. Now I'm going down. Now I'm going this way. So that's one I have done this way, this way, this way, this way. But I don't really like this method because you may miss out. So this is the method I would recommend that you do, or this method. Now, if you have big breasts, Don't be scared, it's the same thing. What you just do is, so if the breast is big, so the difference between a small breast and a big breast is the fat, the fatty deposition in the breast. That's the difference. And so all you need, just pick up the breast like this and press down. Okay? So whether your breasts are small or not, it doesn't matter. Just pick it up and press it down. Then now when you have finished, I said the third thing that we do is squeeze. And that is the nipple. Yeah, because you have to squeeze the nipple. Usually if you are not a breastfeeding mother, nothing should come out of the breast. No fluid, no blood, no water, no milk. If that happens, again, it's good to see the doctor. I know I said it doesn't mean that it's breast cancer, but it is not normal, and so you should have it checked. Okay, so now that I have showed you, I'm going to give us all gloves because it's a practical session. We are all going to learn. This is very, very important.